So hi, everybody. Thank you so much for joining us this afternoon. My name is Jessie Stahl, and I'm the Senior Policy and Program Coordinator at PlantPure Communities. I'm delighted to welcome you all to the Confronting Reductionism Past and Present webinar with Dr. T. Colin Campbell and Nelson Campbell. And with that, I will go ahead and turn it over to Caroline.
Thank you, Jessie. Hi, everyone. We're delighted to have you with us for this webinar focusing on confronting reductionism past and present. All are welcome here, whether you are just hearing about PlantPure Communities for the first time or have been connected to us for many years. My name is Caroline Dyer, and I'm the Vice President of PlantPure Communities. I'm joined by two of our staff members, Jessie Stahl, who you just met, and Alice Stevens, who will be helping us with the question and answer session later. We're also pleased to be joined by our founder and chair of our board of directors, Nelson Campbell, and his father, Dr. T. Colin Campbell, who serves on PlantPure Communities' board of advisors. Specifically for this webinar, they decided to pre-record their conversation to share as much information as possible in a limited amount of time. After viewing the video, we'll conduct a live Q&A session with them. Let's get started.
Hi, my name is Nelson Campbell. Welcome to our show today on the topic of reductionism in nutrition. I'm joined today by the person who may be the world's most prominent expert on this topic, my father, Dr. T. Colin Campbell. As many of you may know, my father did much of the key research validating the health benefits of a plant-based diet. Over a career spanning more than half a century, publishing over 350 highly technical peer-reviewed papers. He also helped to launch the plant-based nutrition movement with his landmark book, The China Study, which he followed with a second book called Whole, Rethinking the Science of Nutrition. He's also completing a third book on the very topic that we're going to be discussing today. Thank you, Dad, for joining me in this important discussion today.
Thank you. It's a pleasure to be here.
So I'd like to start our discussion today with a couple of stories from the book that you're currently finishing. One that I found to be very interesting was the story of Frederick Hoffman and the claims that he made about diet and health.
Yeah, Hoffman, who lived in the late 1800s and most of the 1900s, did a number of things. He was a founder of the American Cancer Society, in which case he said at that time that among the things that society should consider is a possibility that nutrition is involved in cancer. He was really giving this a lot of attention. After that, he founded the American Statistical Association, a very prominent society today. He organized a 22-city survey of nutrition practices around the country in 22 cities. And he also then finally wrote a book in 1937 calling attention to the enormous amount of research in his mind that had already been conducted by others, saying there was something important here about nutrition and cancer. Unfortunately, his name was almost totally forgotten.
So in the early 1900s, he was a prominent voice expressing concern about the consumption of animal protein.
Yeah, basically what they were doing in those days, and a lot of people have done since, is talk about protein just in general. They didn't necessarily distinguish animal versus plant because nobody talked about plants having protein.
And in your book, actually, there are other characters who also were making the connection of diet to disease, and specifically animal protein to disease. And one that really caught my eye, and of course I knew his story from before, but it's a fella, George McIlwain, in the, I believe it was the early 1800s, and he was a prominent physician in England, I believe, and he actually became a well-known proponent of a plant-based diet, and people kind of thought he was crazy.
Yeah, he was a man who was born in 1797, to be specific, and he started out his career basically as a practicing physician. They called them surgeons in those days. And he kind of got onto the idea that in the early part of his career that there was something about a plant-based diet was important. In fact, at age 41, he actually switched to become a vegetarian. Not using that name in those days, but that's what he did. But most importantly, what he defended that proposition on was the idea that cancer is caused by multiple factors. It was a whole body response. He called it the constitutional nature of disease. McIlwain, had it not been for McIlwain, I don't think we would have heard much about this constitutional nature of disease, which in fact meant nutrition.
So I'd like to dig into this idea of the constitutional nature of disease, because it's connected with the topic that we're addressing today. But before we do, there's an interesting connection of George McIlwain to you. What is that?
I was in London at the time, or in Oxford, and I was looking into the history of the whole fields of nutrition cancer, the separate fields of nutrition cancer. And his book came to my attention. When I was reading it, this is in 1985, 86, midway through my career, I felt like, I felt this really had almost a sensation. I feel like that I wrote the book. So I started looking into who was this guy, George McIlwain. And all of a sudden I recalled the fact that about 15 years before, your mom and I had taken my mother, back to Ireland where he was born. And he met some family, including some first cousins, who knew quite a bit about my dad's mother, my grandmother. And her name, last name, or maiden name was McIlwain. I'm convinced he was either my great-grandfather or my great-uncle. I'm not sure yet, because I really want to get my hands on the document that says, exactly which one it is, but he's either my great-grandfather or my great-uncle.
It's pretty remarkable that there was this crazy plant-based advocate running around the early 1800s.
He didn't use the word plant-based, but he basically talked about nutrition. And he talked about other factors that obviously led to that concept.
Yeah, but he did advocate a plant-based diet, and he lived it. He lived that.
He lived it.
So maybe his spirit is in you.
I don't know.
So he was a big proponent, as were a few others, of this constitutional theory of disease. So what exactly does that mean?
Well, in those days there were, generally speaking, two views. One was called the local theory of disease, in which case cancer just suddenly appears as a disease someplace in your body, and therefore it can be cut out. That was the surgeon's view. Also, there was the view too that cancer was caused by a specific agent. So cancer, both in the starting point and the ending point, was considered to be a very specific disease for which there were very specific factors causing. That's the local theory of disease. In contrast to that, McIlwain's view, and before him John Abernathy and so forth, their view was, no, that's not really what it is. It's the whole body response. There's something more going on here. And that was his way of, quite frankly, defending the proposition of nutrition being involved.
So that sounds a lot to me like the distinction between what you oftentimes refer to as reductionism and holism. Holism being the constitutional theory of disease, and reductionism being the local theory of disease. Do you see it that way? And how would you succinctly define holism?
You're quite correct. I mean, at that time, I didn't think about reductionism, holism at that moment when I was seeing McIlwain's book and reading it. But as time evolved, looking more into it, yes, the local theory of disease, which eventually became adopted as the main reason for cancer occurring and how to treat it. That's what really got adopted by the professions at that time in the late 1800s.
Treat cancer with surgery and radiation and chemotherapy.
Yeah, very specific, identifiable sort of causes and treatments. In contrast, cancer, physical constitutional disease obviously involves the whole body. That's holism, what I call holism, with the W in front of it. In which case then we're talking about whole food. We're talking about the infinite numbers of factors in food, many of which are called nutrients, actually working together to create the response. And not to create a single response, creating a lot of responses.
So seeing through a holistic lens, you're really acknowledging this infinite and mysterious complexity that is biology. And you're also recognizing the self-healing, the self-correcting nature of that complexity, as opposed to seeing biology as you would see a machine and seeing it in discrete pieces and then trying to intervene and change those pieces to change the whole. So it's really, that's two very different ways of seeing biology.
I couldn't describe it better. You did a good job. Mm-hmm. But eventually that idea, as I started thinking more and more about it, actually the constitutional nature of disease, or holism, I basically describe that as nature.
Yeah, nature's holism.
Yes, so it's nature versus the reductionist point of view, which is technically trying to get answers and solutions.
It's more technology based.
Yes.
It's more quantitative. It's more founded on the idea of human intervention. And it's interesting because in history, going back to McIlwain and others, and of course yourself, people who've advocated a more holistic view have gotten a lot of blowback, haven't they?
Definitely. I mean, of course, that's the question, exactly the question that I was sort of asking myself. You know, because initially I was interested in doing this history because of the blowback I was getting at that time, already pretty intense. And I was confused by, where does this hostility come from? So looking into that question, we came up with some ideas that I find really fascinating. How, in fact, our profession, either in medical research or medical practice, is very much oriented right around the concept of the local theory of disease.
What do you think motivates people to think in a reductionist way, especially in your community?
Well, partly it's the search for the magic bullet, as many people have heard. It's a simple way of sort of simplifying the whole process. That's one thing that we do, I guess, when we're first hearing of things. We can make money. We can pick out a single agent, for example, in food and maybe turn it into a specific nutrient, put it in a pill. We can even go further. We can maybe, instead of using a nutrient, which is a natural substance, we can take a nutrient, which can't be patented, by the way, and create a new chemical, unknown to nature. That's the drug industry. So all of that sort of evolution of ideas, coming around, starting out with the local theory of disease, morphing into the concept of reductionism, basically offers the idea we look at specific things, makes money.
Yeah, so seeing the body as a machine that we can manipulate is great for the capitalist system, right?
That's right.
It's easy to make money if we see it that way. And something else that we've talked about a lot too is, I know we both agree on, but I'll just mention it, another factor driving a kind of reductionist way of seeing is quite frankly, it's ego, it's the desire to be an authority, it's the desire to be in control. This issue of economics is very important, but I also think that the second issue of ego and the need to be in control and to be the authority, that's also important, because I know that in your life, and in fact you detail this in this third book that you're completing, you've had to deal with that all of your working life, and you've made a lot of people very uncomfortable. People who do see themselves as authorities, who do see themselves as the locus of control. Here you come along and you say, no, it's really nature, and we just need to sit back and give the body what it needs and it'll take care of itself. That's kind of unsettling sometimes to people.
Yes, of course. I mean, to people who, as you say, are maybe fixing their ego or using their ego to make arguments, they basically own something. They're getting money. And it does come from ego, and eventually it leads to control.
Or money or influence.
Yeah, that's just the way.
Reputation.
Exactly.
Yeah. So in your book, in this third book, you detail some of the struggles that you've had confronting this reductionist viewpoint. And you make a point about the societal consequences of reductionism. what are the consequences of reductionism to society in your profession, the profession of nutrition and health?
Well, the first thing that comes to mind is the fact that it causes confusion. When you have so many things, and there's an infinite number of factors we can discover, and we can cause them causes, not just of cancer, but other problems too. When there's so many factors to draw on, and if we just pick up one at a time and we see something about it that we can sort of tell stories about it, then all of a sudden you've got everybody sort of picking out their favorite sort of chemical or nutrient or substance in the food and trying to make a business out of it. Or if not, just simply talking about it. So confusion is the biggest consequence. Enormous confusion occurs.
Well, something else that you've always said, and it's really kind of what I was driving at here, is in this environment of confusion where no one really understands the truth, there's no guiding light, it creates the opportunity for corruption. It creates the opportunity for corruption in industry and in government and our healthcare system. It allows people to pursue their own selfish agendas because there is no fixed point of truth. So we have all of this confusion out there, and we've had it for a long time, and industry and government and academia all contribute to this. And so when you think about it, the deck is really stacked against the public. And in this environment, you've got some pretty powerful industries manipulating the public, the pharma industry, the healthcare industry, the food industry, agricultural industry, and all these industries have their stooges in Washington, and they're manipulating the public. And so you and I, we don't need to talk about this today, but I know that we agree that the only way to counteract that is by getting the truth out to the public in a more grassroots way, empowering people to do that in their own communities. And if you can pull people together around the truth, it can be a powerful force, but it's not easy to do. And I know we both agree on that. There are many obstacles to this idea of a grassroots movement. And what I'd like to focus on for the rest of our discussion is one of those obstacles that relates to this idea of reductionism. And you and I have always said this, we agree on this, that in order to build a plant-based world, we have to give people food that is pleasurable, that is joyful. Unfortunately, I think there are some ideas circulating in our community that make this challenging. And so what I'd like to do is I'd like to discuss a few of these ideas and then provide an opportunity for you to comment on these things, because this is very, very important. It's urgent that we build a plant-based world for reasons of health and our environment and our climate. And we don't have as much time to do this as we may think. And so this issue of how do we do this, how do we get people to buy into a plant-based diet is a very, very important one. So the first idea that I'd like to have you comment on, and it's an idea that's become quite prevalent in the community, is this idea of a SOS-free diet. That means a diet that has no salt, no refined oils, no refined sugars. And of course, we agree on the oil part of that. You don't need oil to produce great tasting food. And oil's definitely not a good thing, and it's easy for people to overindulge in oil. But what about this notion of eliminating every last grain of salt and sugar from food, and taking that out of the equation? What are your thoughts on that idea?
I think it's really been, that discussion has been way overextended. The idea that somehow by doing that we're going to be healthy, it doesn't make any sense. There's really no scientific evidence in my mind that actually supports that point of view. It's a form of reductionism. So it's focusing on, if I just don't have any of that, I'm going to get better or this. That's really, that's foolishness, total foolishness. It just simply does not make sense. And in the process, we tend to ignore the big story. The big story is eating that food, first off. Secondly, some using that carefully, let's say the salt and the sugar, actually can help to sell the bigger idea in many cases. Obviously, you don't want to overdo it, but I can make an argument that that's also just a fact, supported by evidence. A little bit. Be careful. Don't live on that all day long. Nobody does really. But we have no scientific evidence to show that eliminating every last crystal of either salt or sugar that's going to be gaining health. Mm-hmm. Nonsense.
So kind of what I hear you saying is that fixating on this idea of eliminating every last grain of salt and sugar in your food is reductionist because it's ignoring the holistic effects of a whole food plant-based diet. So, and we've talked about this before, when we eat a whole food plant-based diet, there's a tsunami of healing effects. And fixating on eliminating every last grain of salt and sugar, it's a little bit like fixating on a ripple in front of the tsunami. It's just not consequential, it's not really important. And of course it makes it very difficult again to share this diet with mainstream folks.
Fixating on those details really diverts attention away from the big story. It's that simple. Yeah. Furthermore, we don't have the scientific evidence to say the absolute absence of those substances is harmful. We don't have that. In fact, we can make arguments that may be helpful, especially in regards to the fact it helps people to use this whole food plant-based diet.
Mm-hmm. And of course, just to be clear, we're not advocating for heavy use of salt and sugar. We're only talking about, is it okay to use low amounts of salt and sugar in your food to create flavor? Another idea that I hear a lot of in the community today is this phrase, the fat you eat is the fat you wear. And of course, when it comes to the consumption of refined oils, I think there's some merit to that idea. But I hear a lot of people advocating against the consumption of whole foods like nuts, seeds, avocados, and coconuts. What do you think about that and this notion of the fat you eat is the fat you wear?
First of all, the fat you eat is the fat you wear. That's a very superficial comment to make. It doesn't work that way biochemically. We should not be making that statement, first off. Secondly, the fat we talk about that may be problematic is the added oil isolated from the whole food. The food itself, like nuts and seeds and so forth and so on, they're kind of rich in, there's a reason for nature putting that in there. It enables them to get a kickstart, when they start growing new plants, as an aside. But to say that the whole food is the problem also is not correct. In fact, the evidence shows that nuts, a lot of evidence, very convincing evidence, that nuts, if anything, have a benefit. They're rich in vitamin E, for example. That I've known that in the trade for decades. A lot of us in the business have known that. And to eat nuts, of course, is higher in fat for a specific reason. We don't want to just make up a whole meal just with nuts and seeds, quite frankly. But that's good food. And the evidence shows it's good food. It's that simple.
I know that you just did a really deep dive into all of the research out there on nuts, and you were quite impressed by what you saw. And again, we're talking about modest consumption of nuts. So consuming nuts as nature would present them to us. So not eating bags of shelled nuts, but maybe it's a handful of walnuts on your oatmeal in the morning or something like that. And the evidence all suggests that that's actually heart healthy, according to what you found.
Yes.
And that makes sense when you think about it on an intuitive level, because you always argue that a plant-based diet is optimal because it comes from nature. It's what's natural to us. It's what we evolved on over time. And I always remember being a kid and Mom shooing us out of the house, and we were outside most every day, and I used to hike and camp and ride horses, and the forests were littered with nuts. I could ride across our farm in Virginia and find 3 or 4 different kinds of nuts and would stop and eat and go on to the next thing. And of course, in the tropical regions where humanity spent so much time, there are avocados and coconuts. And somehow I don't see our ancestors having walked around with lab equipment measuring the fat content of an avocado.
No,
Do you?
I would say. Yeah, it is part of nature, she said.
Yeah.
Silly.
The other thing that you've mentioned before, and you might want to comment on it here, is that the logic behind this statement, the fat you eat, the fat you wear, is the very same logic that the dairy industry used to promote dairy consumption. Basically what they said is eat these calcium-rich foods because the calcium you eat is the calcium that your bones will wear, right? That you'll wear in your bones. It's good for your bones. When in reality now we're finding that societies that consume high levels of dairy and meat products actually have weaker bones. In fact, their bones are not wearing the calcium. It doesn't work that way. Biology is not so simple. It's not just what you intake, it's how the body utilizes what you consume.
I think the best answer for that calcium question, this is evidence that was available back in the 1980s and before, by a friend of mine, by the way. But that evidence, simply, if you plot the calcium intake in different societies against the rate of bone fracture, which in turn is related to osteoporosis, the higher the calcium intake, the higher the fracture rate. Just to go along with what you just said. More calcium, excessive calcium in that particular form, causes health problems, not solutions.
Right, so just eating more calcium-rich foods like milk and cheese doesn't ensure that your body's going to retain that calcium.
That was a good sign, a good example of reductionism, by the way. Giving special value just to that one element, calcium. Of course, calcium is important, but it is being used to sell a food product.
Yeah. So when you hear that the fat you eat is the fat you wear, you're hearing kind of a reductionist thought, because it's not taking into account what happens after you eat the avocado or the nut or the seed. It gives no consideration to what happens in your body and how it's utilized.
It's a superficial comment from one point of view, and that is that we're thinking that suggests all fat's the same. It's not.
Yeah.
So leave that out.
So another category of ideas circulating in the community is this notion of eating certain foods because somehow certain plant foods are better than other plant foods. And I've heard, for example, the advice to overconsume really greens and having multiple servings of greens a day because maybe it promotes production of nitric oxide and helps with endothelial function, maybe somehow prevents heart disease. But in reality, heart disease is an incredibly complex process that occurs over time. So does it make sense to seize on one sliver of that process and then look at a food that may affect that one sliver and then advocate for the overconsumption of that food? Is that something that makes sense?
It is. It's not appropriate. It's simply not appropriate to focus on one mechanism. It can be used for discussion to illustrate how things work, but it should be left at that. One mechanism being used to describe a whole condition, that's inappropriate, because what happens, if we take that approach, then somebody wants to come along and find a chemical to, let's say, enhance it or block it.
Or a food.
Or, yeah.
Another idea kind of in this category is this notion of nutrient density. The idea that some foods are more, quote, nutrient dense than other foods and therefore should be consumed in greater quantities. And of course, if we accept that line of thinking, maybe we shouldn't even be eating the lowly potato, right? I mean, what do you think about this idea of nutrient density?
I've been involved with that concept since I was in graduate school, but the concept of nutrient density has been really seriously distorted. First off, in order to determine how nutrient dense, let's say, a food is, you have to know how much of different nutrients are in there in theory. You have to decide on how much value to give to individual nutrients. So it's all a constructed bunch of nonsense, actually. I can remember the day when milk was the most nutrient-dense food of all. Now today it's something different. Maybe spinach or kale or something like that. No, that nutrient density concept should be stricken from our language. It really has nothing to do with the scientific evidence that we have.
And there may be some foods like the lowly potato that maybe it's not as, quote, nutrient dense, but it's still important, right?
Well, the potato, I'd like to make another comment on that one there too, is a great source of energy. But interestingly, also, that potato alone, or potatoes alone, have enough protein, by the way.
Mm-hmm.
Has enough protein. We don't need any more protein from other sources like animals.
Yeah. And there's value to just starch.
There's value to, yeah, of course.
Yeah. So there are many of these kinds of ideas, and I just wanted to discuss a few of them as examples of the kind of reductionist thinking that I know has bothered you, that's emerging in the very community that you helped to spawn. You know, but there are many other ideas like this notion of caloric density, for example. I don't know if you want to comment on that. Maybe we've already covered this idea enough, but
well, there's a technical aspect to the caloric density that bugs me. Basically, there is no such thing as a calorie. Mm-hmm. It doesn't encourage something you can pour into a glass or something of that sort. It's just a concept. It's a concept that takes into consideration the heat being captured, or the energy being captured, into food and then distributed in our body. So the caloric density idea, conceptually, okay, it means, don't eat the really high-fat food for all day long. But in reality, just eat the whole food and we get all the calories. Our body, again, comes into play, regulates how to use the calories we do get in a good way.
So this brings us to the really key point of our discussion here, and this is what you always say, and I love it when you say this, which is that it's really simple. There's no need to obsess about all these details. Just focus on eating all the different parts of the plant. Make sure you get plenty of color in your diet.
Colored plants.
Yeah, the various color, because each color represents a different mix of phytonutrients. So eat from the different parts of the plant, different colors. And it's okay to use a little bit of salt and sugar to flavor your food so that you can enjoy it, so that you can derive pleasure from it. And it's as simple as that, right?
One more thing. I just have sort of two suggestions. One is eat the whole food plant-based diet, basically, and stay away from foods that have animal protein in it. That's the goal, at least.
Well, the other thing that we see, and we're involved in social media, and we see some of these things, that the reductionist way of thinking, it also tends to be connected with judgment, extreme views, and judging others who don't to live up to those standards. And I think we need to take a different approach if we're going to build a plant-based world, and it has to be one grounded in a compassionate perspective. And I'll just share a little story to make the point here. We were having some housework done, and we had a handyman come by to help us out, and we started talking and learned that he was suffering from type 2 diabetes. And so we told him what we do, and I say we, it's my wife Kim and I, she was with me. And he said, I might be interested in that, but I'm a really picky eater. This is a guy who eats at Bojangles every day. Really nice gentleman. And we said, you'd be surprised you could enjoy this food. And so it just so happened that Kim was making some burritos for lunch that day. She was experimenting, as she always is, creating new things, and gave him a couple of the burritos. He absolutely loved it. And he said, if I could eat this every day, he said, I'd be plant-based. And, you know, making the diet accessible to people like him is an act of compassion. And also, I look out in some of these underserved communities where our healthcare crisis is most severe, and I look at the way those people are suffering. And right now, on the PlantPure side of our organization, we're creating a line of meal starter products that we're actually going to be making available to low-income communities, waiving 100% of our profit margin just so that we can get this food and information out to these people who need it. But I think we need to, in our community, we need to replace the urge to be right and to judge with the impulse to express compassion. And I think if we do that, we can create foods that people enjoy, and we can change our world around this idea. So that's all I'm going to say, but I want to give you the floor here at the end to say whatever you want to say after this discussion.
Well, I think the entire community, whether it's the plant-based community or otherwise, rely on information that's available to us. We form opinions around it according to our own personal preferences, I guess, but it's related to the information that's provided to us. So therefore, the question is, well, what is that information? Who's creating the information? And unfortunately, if you look back in history, the information we're getting has been basically controlled. And now these days by institutions, whether they are governmental, corporate, scientific, medical, whatever. Institutions have an outsized bit of power. They create the information in their own interest. The public's not getting access to information. In fact, it's very hard right now for the public to get the kind of information that is of most use to them. They're confused. They can't figure all these details. Understandably so. The professionals even argue over what the details are. So the idea is to come back, and a person asks themselves, you know, how much information do I need? And it's really very simple. We said it before. Eat the whole food but plant-based diet. Flavor it up a bit with herbs, spices, and a little sugar and salt doesn't hurt. Make the food tasty, so that people do that, and they will get just that simple notion, and just try to avoid the animal protein-based foods, and that will turn the world around.
So what we need is a grassroots movement that empowers people and communities to share that simple idea.
That's it.
Right? It's very, very simple. Well, thank you for joining me on the show today. I know you and I talk about these things a lot privately, and it's been fun to talk about this and share this more publicly. I'm sure this will generate a lot of interest. So thank you for being part of this.
Good.
Before concluding this part of the program, I'd like to bring up something that's important to me and important to my father. The sponsor of the show here today is the nonprofit PlantPure Communities. This nonprofit is doing some amazing work. We have a network of support and advocacy groups around the world. We call these groups pods. And these pods are helping to spread the message of plant-based nutrition in their own communities. There are over 250,000 people currently connected with these pods, and we gained over 100,000 people just in the past year alone. PlantPure Communities is doing some other good work in the area of climate advocacy and working on strategies for getting affordable foods and education into underserved communities. And what we'd like to encourage you today to do is to consider making a donation to PlantPure Communities. It's how PlantPure Communities survives. PlantPure Communities is not a business, it's a nonprofit. So we would like you to consider that, and if you are interested in making a donation, you can go to their website at plantpurecommunities.org. thanks, and thanks for joining this part of our show. And hang on for a little while longer because there is a live Q&A coming up.
Thank you, Nelson and Dr. Campbell, for that stimulating conversation. My name is Ella Stevens, and I am the Pod Support Programs Manager at PlantPure Communities. Before we get to the audience questions, we'd like to address why today's topics of discussion are relevant and important for groups in the PPC Pod Network to consider. As Nelson mentioned, pods are local independent groups that provide a supportive, inclusive environment to people who are interested in transitioning to plant-based nutrition, or to those who are already living this lifestyle. For this reason, we believe the ideas shared in this webinar are critically important for our pod leaders and pod members to understand, which is why we have a culinary philosophy statement summarizing them, which you can find on our website. Okay, now onto the audience questions. So we heard a bit about coconut and nuts and avocados, but we were asked specifically that these plants contain saturated fat. And they would like to know, what is the verdict on plant-based saturated fats? Do they pose the same health risks as animal-based fats? And is this something we should be concerned about?
Actually, that's a story that goes back many, many years. And unfortunately, we have been operating on, I'm suggesting, the wrong assumption. Basically, saturated fat is not the bad fat that we always talk about, to be honest about it. Saturated fat, chemically speaking, is rather inert in many ways. It's not terribly reactive. If there's a fat that is more reactive, can cause more problems, it's unsaturated fat, which is not a problem if you're getting it food on one hand, but it is a problem if you're isolating it out using as oil. So the saturated fat in coconut food, for example, that's the whole food. And so we got two things going for it. First off, the saturated fat is in the whole food, and with all the rest of the complementary material, it works quite well. And secondly, as I said, from a chemical point of view, it's not very reactive. So the saturated fat in coconut is fine. It's fine. We can use coconut and not worry about that saturated fat content.
Thank you, Colin. So our next question here has to do with DHA and EPA supplements. They would just like you to share your thoughts, whether we need to take those supplements if we're consuming a plant-based diet.
That's really, from a biochemical point of view, it's rather complex, it's interesting, but quite frankly, I don't get into the supplement business, never have, ever since I was, in fact, a person that was actually in the docket for the National Academy of Science on this question way back in the 1980s. Those fats, they are important. Whether they're called omega-3 or omega-6, they're both essential fatty acids. It's really more or less the ratio of one to the other, that being something like 2 to 1, 3 to 1, something like that, of the 6 to 3. That's what's provided by food. We're having a lot of discussion right now about the DHA and omega-3s, omega-6s, getting all concerned about it. It's creating far more discussion than necessary. It's really kind of foolish. I don't really, quite frankly, see the evidence. In fact, I see the evidence to the contrary, that taking omega-3 fats, for example, is that beneficial, if at all.
We have another question related to when we're eating foods. How are plant foods like nuts and seeds helpful from a culinary perspective?
I like nuts and seeds. It's good food. It's good food. As Nelson was pointing out before about the idea of walking through the forest, and if we went back to ancient times, they were there for eating. And I see really no problem. I mean, we don't, the evidence really suggests, if you look at it broadly, and take a broad look at it, the evidence suggests that nuts and seeds are good. Obviously, it's like everything else. We don't need to go to the extreme and that sort of thing, but you have nuts and seeds with our food as part of almost a condiment, or certainly even a significant part of the food. I don't see a problem with that. It's good food.
And to answer the question more specifically, though, about the culinary part of this, we've had a lot of experience developing recipes and different foods, and the use of nuts and seeds and plants that have some whole fats, that's actually very helpful from a culinary perspective to produce foods that people, traditional eaters, will enjoy. You know, the key, of course, is not to overdo it. And as we said in the taped session, we're not advocating that we eat these things out of context. You know, that we should consume these things as nature presents them to us, so in moderation. But adding a little bit of nuts and seeds and other fatty plant foods can be very, very helpful in creating recipes that traditional eaters will enjoy.
Thank you. Okay, so how do you view the keto or paleo diet? Lots of people claim short-term success with health benefits or losing weight.
Well, again, and most of these questions, they have some roots, some historical roots. The keto diet, paleo diet, as you know, is one that tends to be very high in fat and protein and low in carbohydrate, namely the refined carbohydrates like sugar. That was born with Dr. Atkins' book in 1973. It's been around a long time. And that, I know the history quite well. That was initially started as a reaction against those of us who were involved in talking about eating high carbohydrate foods like vegetables and fruits and grains. That struck a political chord that wasn't very pleasant, quite frankly. And so they, in order to try to counter this recommendation to consume plant-based foods with the good carbohydrate, in order to counter that, the argument came up that carbohydrates are not so good. And so what they, if they had said that in terms of refined sugar, that's one point. But they're talking about the context of whole food. So you have to look at the history of this to really get an answer to that. And so we end up with low-carb diets being something special, if you will, coming under very specific names. And the paleo diet and you know, other kind of diets like that, the keto diet, if you will, refers to the fact that these diets, high in fat, high in protein, low in carbohydrate, you're going to be able to, the body's going to be able to break down the fat in the body. And it's a very narrow reductionist point of view, to use that term again. And quite frankly, if you think of these diets as being high in fat and high in protein, I'm looking at them more broadly in terms of how they relate to various disease occurrences around the world in different societies. The higher the protein, animal protein in particular, it's almost a linear relationship, quite frankly, the higher is the risk for these diseases. So I know the paleo diets and the keto diets in the short term cause some weight loss. That's a different question, but they aren't sustained. People tend not to want to have them, for one thing. And the other thing, they don't have a long lifetime. It only goes toward the health point of view that is not healthy, quite frankly.
Thank you, Colin. So our next question here is really talking about the benefits, many benefits of a plant-based diet. In your opinion, what is the magic about the whole food plant-based diet?
Good question. The magic, from my point of view, keep it simple. Keep it simple. And I think about that a lot. We can get caught in the weeds in a million different ways on this question. I have reduced my thinking just down to 2 points. Basically, consume the plant, first off, let me say it this way. Try to avoid if possible the animal protein component. There's a lot of problems there that people are not paying attention to. So try to avoid the foods that have protein, and animal foods that have protein in it. And in turn, that's number one. Number two, consume the remaining food, the plant-based foods, in the whole food form as much as possible. And what I'm saying by whole, by the way, it doesn't mean that we can't dice and slice and cut it up and maybe cook it and so forth and so on, which some people might want to call processing, technically correct on the one hand, but I'm talking about when we consume the whole food, what we're really doing, what the body is looking at, is all the stuff in that food being consumed more or less at the right time. That's the way nature likes it. And so the individual nutrients, in fact, that are being consumed, some of which we've had to be careful about, so we say to ourselves, or and so forth, is not enough. When it's in a whole food form, the body steps in and decides, what it wants to use and how to use it, where to send it, so forth. So the whole food plant-based diet to me should be simple. If people just stuck with the idea of staying with whole plant-based foods, left it at that, don't add back all the, a lot of oil, especially to this kind of food, we'll get, I'm going to suggest, at least 90% or 95% of the total benefit that's achievable. So it's just simple. That's the main thing. Let's keep our eye on the big picture, for example. We could cause major change in the world if we just thought of it that way, rather than get caught up in these really kind of silly arguments about the exact amount of this, that, or something else. It doesn't make sense.
Right, and a related question to keeping it simple and appealing to as many people as possible. How do you recommend people share the whole food plant-based message, especially with those who are resistant? And Nelson, if you have any thoughts you wanted to share specifically first, since you've built up the pod network over and had the vision for that, it'd be great.
Yeah, thanks, Caroline. I think that first and foremost, we have to be humble. We can't be strident. We can't be judgmental. Again, we have to come at this with compassion and not the desire to be right or even to be an authority. So we have to be humble. We have to be compassionate. I think we also need to figure out how to promote this message in a way that connects with people's values. I think that's very important. And I think that the idea of community here is important, because it's really people sharing this with other people. And we have to figure out, how to empower people to do that. How do we get this message out in a grassroots way through our communities? And I think we also have to figure out how to provide community to people who've decided to do this, who are living this lifestyle. Our peers are very powerful influences on us, and we have to figure out ways to create community that helps people sustain their commitment to this lifestyle.
Yeah, if I could just add a comment too, and that's basically, Nelson, of course, to support what you said before. But I'm actually very excited about the concept of pods. That is, these sort of wellness groups, if we can call them that. It's a great means by which we can communicate this message through a community kind of atmosphere. I quite agree that the community idea is really important. We see it working elsewhere. We kind of like it. And I think the more that we can have that particular system, that structure adopted and supported, I think that is a great means by which we can get this message out. But by the way, you were talking something else about Nelson, and I'm going to go about not being too strident, not being too aggressive in our message and judgmental, which I totally support. Sometimes I have to say I appear to be that way, of course, maybe possibly. But what I'm talking about, all I want to do is tell the science as I know it. I want to tell it in a way, here's the facts. But then I'm going to back off in the second sentence, it's basically second step. I really appreciate and respect the choices people make. It's just that simple.
Yeah, Dad, I've been to more of your lectures than I can even remember, and I've never heard you be strident.
Well, I sometimes I think that to myself, but so be it. I do have a great deal of respect for good science, and I think that's the way we should present the message. That's the possible.
Another question, somewhat related to the pod network. Do you think that the plant-based movement involving health and nutrition folks and the vegan movement involving animal rights folks should work together towards their goals?
Yes, that's a good question. I know that the message I've talked about obtained through science. I went there not because I was I chose to be a vegan or vegetarian. It had nothing to do with it, quite frankly. I was strictly into science. In fact, I was on the other end of the spectrum, as many people know. I was advocating consumption of more protein. And so science is what drove me. Obviously, that was appealing. That was appealing to the vegetarian and vegan communities, and I fully appreciate that. I also appreciate, too, the motivation that comes along with that. You know, to be gentler with the other species, you know, of the earth and other animals. I mean, that's a great motivation, obviously. But I kind of back off. I don't particularly like to just use that as the sole argument for achieving benefits. I want to come back to talk about, you know, the science, the food, the personal health, and so forth and so on. As far as the difference in the health properties of, let's say, whole food, plant-based, and vegans, unfortunately, the vegans and vegetarians, if you look at the average nutrient composition of those foods, they're not nearly as good as what they could be. Quite frankly, the biggest study of all that I know of is the EPIC study in Europe that shows very clearly that the fat content of vegans, vegetarians, and the Western diet, that's the carnivorous diet, the fat content of those three diets is almost identical. It's really remarkably the same. Also, the free sugar content of those three diets, again, is remarkably almost identical. Of course, the vegetarian vegan diets, on the other hand, they don't have the animal foods. That's a step in the right direction, except for the vegetarian diet still using dairy, obviously, the problem. But on the other hand, we're all in the same camp, really. I mean, we're talking about motivations, I think, to some extent. And we just need to come back, take a step back, look at the science. And I am at the point right now, I'm very enthusiastic. I really am enthusiastic for the science that simply says eating whole food, plant-based diets is good. And that's beneficial to whatever persuasion we may belong to.
Yeah, Ella, I would just add that I think for too long, these communities have been living in their own silos. And it's not just the vegan community and the health conscious or sort of health motivated plant-based community, but it's also the environmental community. I think there are social justice issues as well that play into this. Our healthcare crisis is most severe in our underserved communities, those forgotten communities. And I think if we're going to launch a movement to change the world around this idea, we have got to unify. We've got to reach out to these other communities, and we've got to figure out how do we make a bigger argument that can bring everyone together. And I know it sounds a little simplistic, but I think there is a bigger argument, and it's this idea of building a culture of compassion. The only way that we're going to get out of so many messes that we're in today is by really going deep and changing our philosophies, changing the way that we see the world, the way that we see one another. And we have to work on building a culture of compassion. And, you know, the health message, you know, that's about compassion. It's compassion for ourselves and compassion for our those around us. The vegan community, that's about compassion. It's about compassion for animals, for other species. The environmental movement, that's about compassion. It's compassion for the planet and for all the other species that share this planet with us. And people who are concerned about social justice is about compassion. So I think that there's a way that we can build a bigger argument to bring everyone together around the idea of a grassroots movement. And I think we need to work on that.
Yes, I agree. Okay, it is time for the last question quickly. Do you see signs of positive change in society regarding our health and the planet and the plant-based movement? And what are your thoughts on the current plant-based trend?
Yeah, I do. I mean, we all have noticed, I think, at least in the West and Europe, I suspect too, that there are changes in the last 10, 20 years. I have seen it myself, and you young folks have seen some of that yourself. So it's trending in the right direction. I get a little anxious at the time, but I think sometimes it's going too slow. Of course, I'm getting longer years, and I'd like to see that, more change. But it's going in the right direction, no question about it. I would ask this one last comment that I made before, and I want to say it again, that one of the significant things that needs to happen, for this movement to go forward, is to get the government and the regulatory authorities out of the business of representing the corporate sector. It's time that they sort of stand aside, let the information flow, for people to choose and make their choices of whatever they wish to do. And unfortunately, at the present time, that's a matter of public policy, and I've been involved in that for quite a number of years. And I feel quite strongly that it's a creation of information, delivery of information in a good form, and then let the people choose what they wish to have. They'll see for themselves.
Yeah, I think we have a lot to be proud of, and there are a lot of people out there who are contributing to this effort. And everyone who's contributing, it's all important. It's all equally important. Whether you're a blogger and you have thousands of followers, or you're just a parent sharing this with your son or daughter or someone that you love. Everyone's important. I do think, though, that there's an urgency to this. I think that not just for reasons of health, but also because of our environment and our climate, I think that we need to make this happen faster. And I think we'll probably be having a future webinar on this topic of food and climate. We're actually involved in an interesting research study right now that will be generating some results that I think will be astounding to people in terms of how big an impact our food choices really are. But this is a very urgent issue, and it's why we wanted to do this webinar today, because I think we all need to come together to build a plant-based world. And first and foremost, to do that, we have to make this diet accessible to people.
Great, thanks so much, both of you. We hope you'll continue to engage with PlantPure Communities by following us on Facebook and Instagram, and by subscribing to our email list to hear about our latest news and get announcements about upcoming webinars. Anybody and everybody is welcome to join or start a pod, and we hope you feel inspired to do so to help build the grassroots movement. You can find out if there's a pod in your community by visiting our website, and while you're there, check out the great resources and news we've shared, and consider making a donation to PlantPure Communities to support the work we are doing. Thanks again to Dr. Campbell and Nelson for their participation in this webinar, to Brian and Marco for creating the video recording of their conversation, to my coworkers Jesse and Ella, and to everyone who joined us here today.